Hello everyone, dear friends. Welcome to our channel. Let me remind you once again, our channel is about medicine. We specialize in treating the musculoskeletal system. At the moment, we are filming videos about manual therapy, the techniques we use, and how we work with patients. During the examination, we naturally take the patient's medical history and then proceed with the manual therapy itself. That's it. Today we have a patient with us. Her name is Valeria. Please tell our viewers what brought you here, what concerns you.
Sometimes I experience an issue like back pain. That's it. I've genuinely tried to effectively deal with it, and it certainly helped for a significant while, but now, unfortunately, I sometimes find myself facing it once again.
Have you had any injuries?
Well, it was with my knees, but nothing specifically with my back. Since I am a professional dancer, I would often bump them a little bit. Basically, something was seriously wrong with them. I honestly do not remember exactly what the issue was, but for quite a while, I unfortunately had to completely stop practicing my routines.
Alright, I understand. This question often comes up when we start taking a medical history. All the materials are collected before the examination, and often the question is asked whether there were any issues with the spine. You ask if there were any injuries, and the patient replies that there was nothing specifically with the spine. It's important to gather all the information, because the musculoskeletal system doesn't just consist of the spine, as we already know or can guess. The load is placed on the lower limbs, and then it is transferred to the spine. Alright, good. Okay. How is your vision, your blood pressure? Everything?
It's fine.
So, as far as you can tell, everything is fine?
Yes.
Well, you found us pretty quickly, so everything is fine. Alright, I think we can basically move on to the examination. Today we have a new patient. I hope our videos will please you. And you can certainly leave your valuable comments about, in general, the practice of manual therapy, how we effectively work, what you genuinely think is currently missing. You can freely write and thoughtfully add your insightful thoughts. And what do you truly think of our dedicated cameraman? Basically, we're ready to move on to the examination. Now we're going to do a checkup. We'll conduct a laser diagnosis. We'll check for asymmetry. Let's take a look and see what changes. Well, in general, you'll see everything now. If, of course, we actually have any asymmetry at all, in general. So that's how it is. If you'd like to make an appointment, the number is on the screen, you can sign up. Right now, WhatsApp is working unstably. Honestly, I don't even know what works reliably these days. So please feel free to use the available links, whichever ones are most convenient and readily accessible for you. I mean to say, the primary phone number is clearly and prominently listed on all our social media platforms. Right, sign up. In general, figure it out. Well, dear viewers, we're ready to move on to our laser diagnosis. So if you're interested, you can use the QR code. You can watch the full video on Boosty, because YouTube won't allow this kind of content. See you there. Well then. So that's the kind of hibjik we ended up with. I'm letting go of the shoulder. Is everything in place?
Mm-hmm.
We're trying to move the shoulder blade. Pull it back a bit and mobilize the joint itself, of course. That's why the position is like this here. To the other side?
No, well, actually, let me see. Well, I must say that is truly excellent.
In terms of their overall temperament, Rottweilers are indeed quite similar. Okay, just relax now. Sometimes they even work in pairs, guarding together. Well, they're good as guards, really. First of all, everyone recognizes that it's a Rottweiler. Relax. There you go. All right, let him in. That's his reaction right now. Please just look simply the other way. Why do you need to look my way? Just relax your shoulder a bit. Maybe I let something in just a little more. Turn your head the other way. And what I've really noticed is that the entire breed has significantly transformed over time. It has definitely changed. I mean to say that it used to be much more aggressive and assertive before. Now it's a bit more reasonable and understanding about everything, which is a significant improvement. Bend your arm under your head, closer to me. Yes, with a turn of the torso. Oh, the other side. Put your hand under your head, closer to me. This particular item goes right here. That one goes over there, right here. Please, do sit down now. Face the people, so to speak. X, further to the target duration of 3 seconds. X, what did you say the group is called?
We forgot some singer like that.
Is she really like a foreigner nowadays?
Yes.
Yeah. Keep your jaws together, but without any undue pressure at all. Yeah, just a little bit. This is for one of us. Whose? In the other direction. Tilt slightly. Like this. Yes. Relax. Incline. So, what exactly precisely happened here, you might genuinely ask yourself? Absolutely nothing at all, really, truly, nothing whatsoever. Nothing happens. Relax, relax. Let go of your shoulder. What happened? Nothing. Lie on your stomach. Elbows slightly together. Now we'll make a little stretch. Fine. Well, we actually translate accurately and effectively. Shall we translate? No, we don't translate. We're moving on. We're moving on to our diagnostics, the control test. Let's see what has changed for us. Well, we're ready to move on to the control diagnostics. Now, after the manipulations, we'll see what has changed for us. And we'll start with the stadiometer. You can watch the full video on Boosty via the QR code. These videos won't be allowed on the YouTube channel, so we'll see you there. So, Valeria, what can I say to you? Your session is over for today. Yes? Are you happy?
Actually, I feel much better.
When? Lipu, right? Then...
Before this, yes.
Okay, and what was it like before the encouragement, and what is it like now? Well then.
It was significantly more unpleasant to actually do something on this particular side.
You were working on the right side of the shoulder blade. It felt like it was easier on the left side. With the shockwave therapy, so the right side was really pronounced. The right side, as we've already realized, is overloaded, and it's still overloaded anyway. And honestly, I don't know anything in medicine that gets cured in just one go. Even pulling a tooth, I think, still takes several visits. Someone will say it depends on the tooth, but you get the idea. But here there's still more work to be done. Well, the girl is quite young. So, we'll give recommendations in any case. It's gotten a bit easier. How was the decompression for you?
Good. What exactly is the current situation, and how are things progressing now?
What scared you the most that has ever truly scared you? Which procedure?
Probably the cracking sounds, because I didn't expect them.
It's a shame we couldn't see the fox, but I would have liked to. You were definitely really tuned into your body, right? Like everything was just fine and fine. Did anyone crack or mobilize you? You liked it, didn't you? Well, then let me tell you this. You are officially upgraded for today. So, that's why you're upgraded for today, and we'll give you some recommendations. Don't overexert yourself. You need to focus on treatment at the end of your physical therapy and smooth out the right side to make it symmetrical and stabilize it. But you still need to get an examination done. MRI, that stands for magnetic resonance imaging. Well, I truly gave you a really warm hug. Lifted you up, put you down, and put you down again. So until next time. Hopefully in Hollywood? Alright, goodbye everyone. See you next time.